The waiting room smelled like burnt coffee and old magazines. That was Marcus Reeves's world now. A folding chair behind a laminate desk in the Harlow County EMS station, stamping supply request forms and making sure the defibrillator pads got restocked before Tuesday's shift change. Nobody asked him to do more than that. Nobody expected more than that. And Marcus, with his quiet eyes and his unhurried voice and his second-hand uniform that fit just a little too well, never offered more than that. But something was coming to Harlow County that none of them were ready for, something that would crack this small town open like a fault line. And Marcus Reeves was the only man alive who could hold it together. Dr. Elliot Crane ran Harlow County General's emergency department the way a general runs a garrison. Tight, loud, hierarchical. He had graduated top of his class at Johns Hopkins, completed his residency at Mass General, and never once let anyone forget either of those facts. When he arrived in Harlow 3 years ago, drawn by a research grant and a property tax rate that suited his second home ambitions, he had looked at the EMS staff like a man inspecting livestock he hadn't ordered. Marcus had been on shift that first day. He'd rolled a gurney past Crane without a word, logged the handoff, and stepped back outside. "That the paramedic?" Crane had asked the charge nurse Janet Morales without lowering his voice. "Marcus Reeves, been here 6 years," Janet had said. "Any advanced certs?" "Basic life support, standard EMT paramedic licensure." Crane had made a sound low in his throat, dismissive, final, like a door closing. That sound followed Marcus everywhere after that. In briefings, Crane would speak over him. In joint training exercises, Crane would reassign him to perimeter duties, crowd management, equipment staging, tasks that kept him visible but irrelevant. Once, during a multi-vehicle accident drill, Crane had physically redirected Marcus away from the simulated critical patient and toward the simulated walking wounded. "Let the trauma team handle the priority cases," Crane had said, not unkindly, which somehow made it worse. "You focus on what you know." The other paramedics noticed. A few of them bristled on Marcus's behalf. His partner, Deb Kowalski, a 29-year-old with a pilot's license and a competitive CrossFit ranking, had once told Crane directly that Marcus's field assessment scores were the highest in the county. Crane had smiled at her the way professors smile at students who've just said something confidently incorrect, and moved on. Marcus had touched her arm, quietly. "Leave it," he'd said. She'd wanted to argue, but there was something in his tone, not defeat, not resignation, something more deliberate than that, something patient, like a man who had decided long ago that some battles were not his to fight, not yet. What none of them knew, what Marcus had never told a single soul in Harlow County, was that before he came here, before the laminate desk and the burnt coffee and the folding chair, Marcus Reeves had been something else entirely. The call came in on a Wednesday. 14 minutes past 2 in the afternoon, when the summer heat pressed down on Harlow County like a hand on a chest, and the EMS bay smelled like exhaust and sunscreen. The dispatch tone sounded different that day, not the usual triple beep for a standard medical call, a sustained dual tone that most of the staff had never heard activated in the field. Deb looked up from her paperwork. The other paramedics on shift, Tomas Villanueva and Kevin Shire, exchanged a glance. Marcus went still. He knew that tone. The radio crackled. "Dispatch supervisor." Linda Okafor's voice came through, and she sounded like she was reading from a script she'd been given 30 seconds ago. "All units, Code Amber override, Federal Medical Relay request incoming, Harlow County General Designated Receiving Facility. Patient transport ETA 11 minutes, all senior trauma staff requested to stage at Bay 3. Then a second voice. Not Linda's, male, clipped, the kind of voice that had spent years speaking in rooms where every word was recorded and every word mattered. "This is Special Agent Warren Holt, Department of Homeland Security Medical Operations. We are transporting a patient under federal protective custody. Patient is classified. Attending physician clearance is required prior to any treatment protocols. I repeat, treating physician must hold active federal medical clearance. Please confirm qualified staff availability." The radio went quiet. Everyone looked at everyone else. Dr. Crane was already striding down the corridor toward the bay, buttoning his white coat with the crisp efficiency of a man who had been waiting his whole career for a moment that required a white coat. "Federal patient," he said to Janet with obvious relish. "Interesting Wednesday." "Dr. Crane," the radio voice said as Crane picked up the bay handset, "can you confirm your federal medical clearance status?" A pause. Crane's jaw shifted. "I hold full medical licensure through the state of Maryland and the Commonwealth of—" "Sir, I need your federal clearance designator, specifically DHS Medical Operations Clearance Tier 2 or above." Another pause, longer this time. That's not a standard credentialing requirement for emergency." "Sir, this patient cannot be treated by any physician or paramedic without active Tier 2 federal clearance or above. I need you to confirm, or I need you to identify someone at your facility who does hold that clearance. We are 9 minutes out." The bay went absolutely silent. Crane turned. He looked at Janet. She shook her head. He looked at the two trauma fellows who'd materialized at the bay doors. They shook their heads. He looked at Tomas Villanueva and Kevin Shire. Same answer. Then he looked at Marcus Reeves. Marcus was standing at the edge of the bay, arms loose at his sides, watching with those quiet eyes. He had not moved during any of this. He had not spoken. He was holding a clipboard with a supply inventory on it, because that was what he'd been doing when the tone came through. Crane's voice was careful, controlled, but something underneath it had shifted. "Reeves, is there any chance you hold some kind of—" "Yes," Marcus said. Just that. One word. Crane blinked. "What?" "DHS Medical Operations, Tier 3 clearance, active." He set the clipboard down on the equipment shelf beside him. "Who do I need to call to verify?" The silence in that bay had texture to it. Wait. Deb Kowalski was staring at him. Tomas had stopped moving. Kevin had a water bottle halfway to his mouth and just left it there. Crane's voice came out slightly smaller than usual. "How do you—" "8 minutes, the radio said." Marcus crossed to the handset. He pressed the transmit button. His voice was completely different when he spoke into it. Not louder, not harder, but structured, efficient. The voice of a man who had spent years in rooms where every word was recorded and every word mattered. "Agent Holt, this is Marcus Reeves, Harlow County EMS Clearance Designator, Bravo 79er Foxtrot 2. Confirm with Medical Operations Division, Dr. Cartwright's registry." A 10-second pause. Then, "Confirmed, Mr. Reeves. Please stage at Bay 3. Patient designation Nightingale. You'll receive the briefing packet on arrival. Prepare for traumatic injuries, possible chemical exposure, and, sir, the patient specifically requested you by name." Every head in the bay swung toward Marcus. He didn't react. He just started pulling gloves from the supply shelf, snapping them onto his hands with the precise economical motion of someone who had done it thousands of times in places far worse than this. "Deb," he said without turning around, "get me 2 large-bore IVs, normal saline, the portable monitor, and the trauma bag. Not the standard one, the blue one from Bay 2. Deb was already moving before she'd consciously decided to. "The blue one's for— that's the advanced airway kit. I know what it's for." Something in his voice, quiet and absolute. No explanation, no apology. Just the voice of a man who had always known exactly what he was doing and had simply been waiting for permission to show it. The ambulance came in hot. No lights, which was unusual. No sirens. 2 black SUVs flanking it, moving in tight formation, which was not unusual for federal transport, but was absolutely unusual for Harlow County, where the most federal presence anyone ever saw was the IRS agent who came through every spring. Agent Holt was first out of the lead vehicle. Mid-40s, athletic, the kind of tan that came from working outdoors rather than vacationing. He scanned the bay, found Marcus, and moved toward him with the directness of a man who had already decided this was the right person. "Reeves. Holt." They shook hands with the brevity of people who have no time for pleasantries. "What are we dealing with?" Holt pulled a sealed envelope from his jacket and handed it over. Marcus broke the seal without hesitation and read. His eyes moved fast, efficient. Not the skimming of someone in a hurry, but the scanning of someone trained to extract specific information at speed. Crane appeared at his shoulder. "What does it say?" "It's classified," Marcus said without looking up. Crane's mouth opened. "Dr. Crane," Marcus said, still reading, I'm going to need you to designate me as the attending paramedic for this patient. Technically, you can make that call since you're the senior physician on site, and it would be faster than waiting for a federal override. But if you'd prefer to wait for the override, that's also fine. Your call. Crane's mouth closed. His jaw worked for a moment. Then, you're designated. The ambulance doors opened. She was mid-40s, maybe 50. Dark hair streaked through with gray, cut short. High cheekbones, olive complexion, the kind of face that might be striking on another day, but right now was gray with pain and shock, and something else, something more specific, more chemical. Her left arm was wrapped in field dressings that had been applied expertly and were already saturated through. An oxygen mask covered the lower half of her face. Her eyes were open, scanning, assessing, not the random frightened gaze of a civilian in crisis, but the deliberate measuring look of someone trained to evaluate their situation, even while injured. When those eyes found Marcus, something in them changed. Relief, specific and personal, not just the relief of reaching medical care, the relief of reaching someone she knew. "Marcus," she said through the mask. Her voice was rough, medicated probably, something for pain, something for the chemical exposure. "I've got you, Director," he said, and that was the first time anyone in Harlow County heard her title. Director. Crane went very still. Her name was Catherine Vale. That was all Marcus could confirm to the assembled hospital staff, and it was more than he should have confirmed. What he could not tell them, what the sealed briefing packet had laid out in the clipped euphemistic language of federal operational reports, was that Catherine Vale had been the head of a classified medical intelligence division for 11 years, and that 3 days ago, during what was supposed to be a routine field verification in a facility 3 states away, something had gone catastrophically, lethally wrong. What Marcus could not tell them was that Catherine Vale and Marcus Reeves had worked together once in a different world, in a different capacity, and that she had been the person who trained him, the person who had taught him everything. But that was later. That was for the backstory. Right now he had a patient. The left arm was the obvious injury, and therefore the one he assessed last. Experienced medics know that the injury a patient leads with is rarely the most dangerous one. Marcus worked fast and quiet, his hands moving across Catherine's body with the systematic efficiency of a trauma assessment that had been hammered into muscle memory through years of application in conditions far worse than this. "Pupils equal and reactive," he said for Deb's benefit. "BP?" Deb had the cuff on already. 92/64. "Low, not catastrophic, moving in the wrong direction." "Respiratory rate?" 22. "Lung sounds?" He was already there, stethoscope placed. He listened, moved, listened again. His face didn't change, but his eyes did, a fractional sharpening, a recalculation. "Diminished on the left side," he said. "Catherine, I need you to tell me if you have any chest pain." "Mild," she said. "Probably from the fall. I came down on the left side." "How far?" 12 feet, maybe 14. Crane had positioned himself at the edge of the treatment area, arms crossed, watching. His expression had gone through several phases since the ambulance doors opened. Superiority, then confusion, then something that might have been professional recognition, and then something more complex that he hadn't quite processed yet. "A fall from that height with a left-sided landing and diminished breath sounds," he said. "You want to rule out pneumothorax." "Yes," Marcus said without looking at him. "And tension, given the mechanism and the exposure agent." He looked at Deb. "Get me the needle thoracostomy kit." Deb moved. "You're going to decompress without imaging," Crane said. "She's deteriorating, and I have a clinical picture that's consistent. By the time we get imaging, we lose the window." He glanced at Crane for exactly 1 second. "You can override me if you want." Crane uncrossed his arms. "No," he said. "Continue." Marcus continued. What happened next, with the nurses and the 2 trauma fellows and Thomas Villanueva and Kevin Shire all watched from the edges of the bay, was not dramatic in the way emergencies look dramatic on television. There was no shouting, there was no running. There was only Marcus Reeves, moving with a calm so total it was almost frightening, performing a needle thoracostomy decompression with the unhurried precision of a man who had done this exact procedure in conditions that made a hospital bay look like a luxury SPA. The needle went in at the second intercostal space, mid-clavicular line. The hiss of released air was immediate and audible. Catherine's oxygen saturation, which had been trending down to 89%, climbed back. 89, 92, 95. Her breathing changed, easier, less effortful. "Good," she said. "Don't talk yet," Marcus said. He moved to the arm. The field dressings came off in layers. The wound beneath was... Deb actually stopped breathing for a moment when she saw it. A chemical burn, deep and irregular, overlying a laceration that had been packed in the field with the kind of military-grade hemostatic gauze that was not standard issue in any civilian medical kit. "Whoever packed this did a good job," Marcus said. "One of Holt's people," Catherine said. "Tell them for me." He started the process of gently removing the packing, assessing the bleeding beneath it, his gloved hands working with a deliberate tenderness that seemed at odds with the speed of everything else. "This is going to need debridement and a burn unit consult. The laceration I can close here, but the burn is going to need specialized management." "Tell me about the exposure, Agent," Crane said. Marcus looked at Agent Holt, who was standing just inside the bay doors. Holt considered for a moment. Then, "Modified vesicant, similar mechanism to mustard, but faster acting. The exposure was limited. She was only in contact for approximately 45 seconds before extraction." "That's enough for secondary absorption," Marcus said. He looked at Deb again. "Get me sodium thiosulfate, and I need to know your hospital's decontamination protocol for vesicant exposure," Crane said quietly. "We don't have one." Marcus closed his eyes for exactly 1 second. Then, "Okay, here's what we're going to do." For the next 40 minutes, Marcus Reeves ran the treatment of Director Catherine Vale the way a conductor runs an orchestra, not by doing everything himself, but by knowing exactly what needed to happen, in what order, with what resources, and directing every person in the bay toward it with a precision that left no room for confusion and no space for hesitation. He adapted the decontamination protocol on the fly, drawing on a working knowledge of chemical exposure management that was so specific and so current that Crane, who had pulled up a clinical reference text on his tablet within the first 5 minutes, stopped referring to it after 10 because Marcus was already doing things the text hadn't reached yet. He sutured the laceration with a technique, a modified layered closure that minimized tension on burned tissue margins, that the trauma fellow on Crane's left said, in a low voice, she had only ever seen described in a military surgical manual. He managed Catherine's pain with a medication protocol that accounted for the chemical exposure, her blood pressure trend, and what he clearly knew about her prior medical history, adjusting dosages with a fluency that was not the fluency of someone reading from a protocol card. He talked to her throughout. Quietly. Not the reassuring patter that medics use on frightened patients. Something more like a colleague checking in with a colleague, specific questions about her symptoms, her responses, her level of function, and she answered with the same specificity because she was, despite everything, still assessing her own situation. At one point, Crane leaned toward the trauma fellow and said very quietly, "Where did he train?" The trauma fellow shook her head. At minute 37, Catherine's blood pressure had stabilized. 98/68, not where they wanted it, but trending up and holding. The saturation was sitting solid at 96 on supplemental oxygen. The burn was irrigated, dressed with silver sulfadiazine from the pharmacy that Marcus had requested specifically and that Crane had immediately approved, and covered in a way that would hold until the burn unit consult could happen. The laceration was closed, neat, almost elegant. Marcus stripped his gloves off, stepped back, looked at the monitors for a long moment with the focused stillness of someone running final calculations. "She needs to be admitted for observation," he said. "The vesicant exposure could show delayed systemic effects up to 72 hours out. She needs serial blood work every 6 hours. Specific panels, I'll write them out, and she needs the burn unit consult in the morning, not tomorrow afternoon." He was talking to Crane, who was also looking at the monitors, who had not spoken in 11 minutes. Who turned to look at Marcus Reeves now with an expression that had moved so far from where it started that there was almost no trace of the original. "I'll make the admission arrangements personally," Crane said. "The panels, the consult, whatever you need." A pause. "I want to ask you something," Crane said. "Later," Marcus said. "Let me brief Holt first." And he walked away. calm, unhurried, the same man who had been stamping supply request forms 2 hours ago. But not, somehow, the same man at all. Catherine Vale was admitted to the ICU under a federal alias. Her security detail, 4 agents in rotating pairs, took up positions at the corridor junction and the stairwell exit that made the nursing staff extremely aware of how different this Wednesday had become. Marcus sat with her for 20 minutes after the admission paperwork was filed, not in a clinical capacity, just sat. In the chair beside the bed, with his forearms on his knees and his eyes on the floor, the way a person sits when they are processing something they have been holding at a distance for a long time. Catherine watched him. "You look tired," she said. "I'm fine. You always say that. It's usually true." She was quiet for a moment. The monitors beeped their steady rhythm. Outside the window, Harlow County was doing whatever Harlow County did on a Wednesday afternoon, living its small, uncomplicated life, unaware of what was happening 3 floors up. "How long have you been here?" she asked. 6 years. 6 years, she absorbed this. "Doing what?" "EMS paramedic." "That's Marcus, with your background you could be—" "I know what I could be." He looked up then. His eyes had that quality again, patient, deliberate, a man who had made choices and lived with them. "I needed it to be quiet for a while. After what happened, I needed it to be quiet." She didn't push. She knew what he meant by what happened. She had been there for the aftermath, if not the event itself, and she had watched him come apart and put himself back together in the particular way that people who are very good at managing crises are terrible at managing grief, by doing, by fixing, by staying in motion until they ran out of motion and then going somewhere very small and very still. Harlow County was very small and very still. "And now?" she said. He didn't answer right away. And in the silence of that hospital room, with the monitors and the afternoon light and 6 years of distance from a world that had broken something in him, Marcus Reeves thought about the answer. Now everything was different. He knew that already. The bay, Crane's face, Deb's eyes when she'd handed him the IV kit and realized for the first time who she was actually handing it to. The world of Harlow County EMS had shifted on its axis in the last 2 hours, and there was no shifting it back. But he found, sitting in that chair, that he wasn't afraid of that. Not the way he would have been 6 years ago. Not the way he'd been afraid of it every day since he arrived. He found that the quiet had done what it was supposed to do. It had held him, given him space. Let something that was broken find its shape again. And he found that he was ready. "Now," he said, "I think I'm done hiding." They met in Crane's office at 6:30 that evening. Marcus, Crane, Deb, Agent Holt, and the hospital administrator, a silver-haired woman named Patricia Osei, who had arrived at the hospital at 4 in the afternoon in response to a federal notification that Marcus suspected had given her the least comfortable 2 hours of her professional life. Holt opened the meeting by confirming, with the particular tone of a man who spends his working life operating in ambiguity, that he was not able to share most of what he knew about Marcus's background. What he could confirm was that Marcus's clearance was active, legitimate, and of a level that outranked every credential in the room, including his own. He said this looking at Crane. Crane received it without flinching. He had had several hours to work through his various layers of feeling about the day, and whatever he'd arrived at, it had apparently settled into something that looked, remarkably, like respect. "I owe you an apology," Crane said, not prefaced with anything, not hedged. Direct, the way he was direct about everything. "I made assumptions about your level of competence based on your credentials and your position here. I was wrong. It was unacceptable. And I'm sorry." Marcus looked at him for a moment. "Thank you," he said. "I'd like to understand if you're willing." "Some of it," Marcus said. "I can tell you some of it." What he told them was this. He had spent 14 years, from age 22 to age 36, working as a field medical specialist for a federal interagency program that classified him not as military, not as civilian, but as something that sat in the space between, the way most of the most consequential work in that world sits in spaces between. He had trained under Catherine Vale, who had at that time been building the division's medical operations curriculum from the ground up, drawing on her own background as a trauma surgeon and her operational experience in 3 conflict zones. He had worked in, he said carefully, a variety of environments, some domestic, some not, in conditions ranging from standard forward operating base medical facilities to improvised field positions where the difference between a patient living and dying was frequently his ability to do, with what was available, what a fully equipped trauma bay was supposed to do with considerably more. He had been, by any measure, exceptionally good at it. Then, 9 years ago, a mission went wrong. He was deliberate here, sparse. He did not perform the grief or ask them to perform sympathy. He said only that 3 members of his team had died in circumstances where he had been the senior medical officer present and where the deaths were not ultimately the result of medical failure, but where the medical failure had been his and where he had spent years understanding the difference between those 2 things and learning to live in that difference. He had resigned, relocated, rebuilt himself, slowly and quietly, as something that looked from the outside like a significant step down and was from the inside the only step he'd been capable of taking. Harlow County had been a landing place, a holding pattern, somewhere to be competent and unnoticed while he figured out whether there was anything left in him that wanted to be more. Today had answered that question. The field manual you used for the closure technique, the trauma fellow said. She had not been invited to this meeting, but had followed Patricia Osei in and positioned herself in the corner with the quiet determination of someone who had decided she was not missing this conversation. I looked it up afterward. It's from the Special Operations Medical Handbook, 2018 edition. It's not publicly available. No, Marcus said. You wrote some of it, she said. It was not quite a question. Marcus looked at her. Then, a section. Crane leaned back in his chair. He was quiet for a long moment, with the expression of a man reassessing a very large number of things simultaneously. Then, what do you need? He said. Marcus considered this. A proper role, he said. Not attending physician. I'm not licensed for that, and I don't want to be. But something with clinical authority. The ability to make calls in the field and have them stick. Access to the advanced protocols. Training for my team, because Deb Kowalski is already better than you're giving her scope to be. And the same is true of Tomas and Kevin. Crane nodded. Done. And I want to consult on the vesicant decontamination protocol. The hospital doesn't have one. Given where we are geographically, the federal facility's within 50 miles. It's not a hypothetical gap. It's a liability. I'll talk to administration tomorrow, Patricia Osei said, and her tone made it clear that this was not a maybe. One more thing, Marcus said. Everyone waited. The supply inventory, he said. I've been doing it for 6 years because nobody else wanted to, and because it needed doing, and because I had the time. But some of the gaps I've been flagging in that inventory are genuine readiness problems. There are items we don't stock that we need. I want someone to actually review the list. There was a silence. Then Deb said, with a quality in her voice that was somewhere between laughter and tears, "You've been filing those inventory flags for 6 years." "Since my 3rd month here," Marcus said. "And nobody—" "No," he said. She put her hands over her face for a moment. "Okay," Marcus said, with the smallest trace of something that might have been amusement. "I think that's everything." Catherine Vale was transferred to a federal medical facility 8 days after her admission to Harlow County General. Her discharge summary, a heavily redacted document that Marcus completed himself, indicated that she had made a full initial recovery from her injuries, that the vesicant exposure had shown no significant delayed systemic effects, and that the burn on her left arm would heal with minimal scarring. She sent him a message before she left, not through official channels. A handwritten note, folded once, delivered by Agent Holt, who handed it to Marcus without comment and with the expression of a man who had decided he liked this particular assignment more than most. The note said, "You are always too good for hiding. I'm glad Harlow found out. I hope you are too." He read it twice, put it in his breast pocket, and went back to work. The 6 months that followed rewrote Harlow County EMS in ways that the County Medical Board would later, in a formal review document, describe as a significant and measurable advancement in regional emergency medical capability. That document was dry and bureaucratic and captured almost none of what actually happened, which was this. Marcus Reeves started teaching. Not in a classroom, not with slides or formal curriculum. He taught the way he had always worked, by doing, by showing, by standing next to someone who was trying to figure something out and asking the questions that pushed them toward the answer. He taught Deb the advanced airway management techniques she had already been reaching toward and gave her the vocabulary and the practice repetitions to own them. He taught Thomas field triage principles from the combat medicine curriculum that translated directly to mass casualty management, and that 4 months later, when a grain elevator explosion outside Harlow sent 23 people to the hospital simultaneously, meant that Thomas managed the scene coordination with a calm and efficiency that the responding fire marshal said he had never seen outside of a major metropolitan department. He worked with Crane, not always easily, not without friction, but with the growing mutual recognition of two very different people who were both, underneath their different styles and histories and the damage those histories had left, genuinely committed to the same thing. The vesicant decontamination protocol was finalized, reviewed by 3 federal medical consultants, and adopted not just by Harlow County General, but by 4 surrounding hospital systems that Crane, in a move that surprised everyone including himself, had proactively reached out to. The inventory gaps were addressed, all 47 of them. Patricia Osei had reviewed the list personally, and she had reportedly sat with it for a long time in silence before calling the procurement department. Marcus was sitting in the EMS bay on a Thursday afternoon. The supply forms were still there because someone had to do them, when Deb came in and sat on the equipment shelf across from him. "Holt called," she said. "I know. I'll call him back." "He said the director wanted to extend an offer." Marcus looked up. "A consulting position," Deb said, "for the Medical Operations Division, training, protocol development, field medicine curriculum." She paused. "The kind of thing you apparently spent 14 years doing before you came here and pretended to be a guy who restocks defibrillator pads." He was quiet for a moment. "You'd have to leave," she said. "Some of the time," he said. "Not all of it." She considered this. "You'd still come back here?" "This is where I live," he said, and then, after a moment, "And you've still got 8 more advanced procedures to get through before I'm comfortable calling you fully qualified." She threw a pen at him. He caught it without looking up from the forms. Outside the EMS bay, Harlow County went about its business, unhurried, uncomplicated, a small town in a wide landscape, holding its ambulances and its equipment and its quietly extraordinary people in the comfortable ignorance that small towns have of their own resources. But something had changed, not loudly, not all at once. The way the most durable changes happen, through the slow accumulation of one decision made well, and then another, until the thing that was broken has found its shape again, and the shape it has found is stronger than the original. Marcus Reeves accepted the consulting position. He kept his role at Harlow County EMS. He drove the same routes, worked the same shifts, drank the same terrible coffee. But now, when a call came in, his team knew exactly who was standing beside them. Not because he announced it, not because he wore it like a credential or carried it like a weapon, simply because, when it mattered, he showed up. And he was exactly what was needed. And that, it turns out, had always been true. There's something in this story that goes beyond medicine and emergency response, something that speaks to a truth about the way we are with each other. We look at a person's title, their credentials, the size of their office, the prestige of their institution, and we build an entire architecture of assumption around those things. We decide, before we've seen what someone can actually do, whether they are worth taking seriously. And the quiet ones, the ones who don't announce themselves, who carry their histories in silence, who have been through fires that left no visible scars, we almost always underestimate them. We look at where they are and assume that's all they are. We see a man stamping inventory forms, and we see exactly that. Nothing more, nothing less. A small person in a small place doing a small job. But competence doesn't expire. Experience doesn't disappear. The things a person has survived, the things they've learned, the things they've earned through years of living at the edge of what's possible, those things don't vanish just because the person carrying them went somewhere quiet to heal. Marcus knew who he was the whole time. He'd simply decided that Harlow County didn't need to know yet, and when Harlow County did need to know, when the call came in and the stakes were real and the crisis could not wait for the right credentials to walk through the door, the person who was needed was already there, had always been there. Standing quietly at the edge of the bay with a clipboard and 6 years of waiting and everything required to save the day, all of it intact, all of it ready. Don't be so sure you know what someone is capable of based on where you found them. The person you're overlooking might be the most qualified person in the room, the quiet one, the unassuming one, the one who doesn't argue when you redirect them to easier work. They may simply be waiting for the moment that calls for everything they have. And when that moment comes, they will not let you down. If this story connected with you, if Marcus's quiet persistence, his refusal to let dismissal become definition, struck something true, then share it with someone who needs to hear it today. Someone who has been overlooked, someone who has been doing extraordinary work in a role that doesn't reflect their full capacity. Someone who is, right now, waiting for the moment that calls for everything they are. And if you want more stories like this, stories of the people who show up when it counts, who carry the weight of their experience into the rooms where it matters most, then make sure you subscribe, because we tell those stories every week. Hit the notification bell so you don't miss the next one. And tell us in the comments, have you ever been underestimated the way Marcus was? Have you ever been the person who dismissed someone and then been proven spectacularly wrong? We read everything you write. This community is built on those conversations. We'll see you in the next story.